Good afternoon. Welcome to day 451 at the EMA office, where we're going to bring you the latest numbers today and the COVID. Join with Chairman Mark Kern, and you get the honors today of all the numbers.
Thank
Even
you.
the zip codes, we're going to let you do them today, too.
You're always so nice to me. So far in St. Clair County, we've tested 366,869 people. That's an increase of 403 over yesterday. We have 31,216 positives in the county, of which 7 of those are new since yesterday. Those are males and females from under the age of 10 into their 30s. That brings our daily county positivity down today to 1.7%. So far, since time began, we have 335,653 negative tests in the county, and unfortunately 479 deaths. So far, 30,626 people have completed the IDPH required 10-day isolation period. So when we take a look at the state totals, so far we have 24,913,350 people that have been tested. Of those, 1,385,489 are positive, and that's an increase of 244 over yesterday. And also, unfortunately, 14 additional deaths in the state, bringing the state death total to 22,963 people. Hospitalization numbers are still remaining in the fairly low levels. We have 9 COVID-19 related patients in the hospital in St. Clair County currently, with none on ventilators. Regionally, though, we have 14 in the hospital, and we do have 1 person on a ventilator. Congregate living facilities all remain the same, which is good news. So that'll bring us to our zip code report. 62220 is the first zip code today, and they're up 1 to 2,227. 62221 up 2 to 2,978. 62225 up 1 to 161. 62258 up 1 to 1,116. And 62269 also up 1 to 3,503. So we heard our daily county positivity down to 1.7%. That brings our rolling average, our 7-day rolling average in the county, down to 2.2%. Regional positivity, though, remains the same, but it's at 1.6% because Bond County is at 0%, Clinton County also at 0%, Madison is at 1.6% positivity, Monroe is at 0%, Randolph at 0%, St. Clair's at 1.5%, and Washington County is also at 0% today. So Herb, it seems as we wind things down with these briefings that the numbers themselves appear to be remaining pretty static. We had pretty low numbers when we opened up, where only those who had been vaccinated are required to wear masks. Those type of restrictions being lifted in the state, and the numbers have remained the same. So I think IDPH gave the right call. And this Friday, I think all restrictions go away. The only people that will be required to follow certain restrictions are those who haven't been vaccinated.
Exactly. And I think what's really showing with these numbers is that the Memorial Day weekend, everybody pretty well took caution, and because we haven't seen any spike whatsoever, knock on wood, and we'll continue to monitor that over the next 4 days, because that June 11th date is what we're shooting for. As we said yesterday, the light at the end of the tunnel that we've all been looking for 451 days is brighter, but come June 11th, we can all, Team St. Clair and everybody, can take a little sigh of relief and a deep breath and just give thanks to everybody, and still remember the 479 citizens of our county that has passed away due to this COVID, and 22,963 individuals throughout the state of Illinois. Outstanding, just numbers that we never even dreamt of when this first started.
And make no mistake, we will be dealing with the after effects of COVID-19 for a long time. There are people who are going to have health problems that are really going to hang on, perhaps for some people's entire lives. because of side effects of having COVID-19. I was talking to a friend this morning who has a buddy that is still having breathing problems, and they had COVID probably 3 months ago, and they still are short of breath and having issues. So certainly our prayers go out to those long haulers, is I think what the unofficial medical term is, that hopefully there's a cure for that too, and that people can get back to their totally normal, healthy lives.
Well, when we had some of the local physicians on talking about, this was a learning process for even them. And I remember some of those physicians that were sitting on the panel here from St. Elizabeth's and from BJC. It was a learning. Every day they were learning something different, and all of our medical personnel has got to be glad that we're reaching this point now after everything that they've all been through. Our EMS people, our first responders. Like I said, I'm waiting for June the 11th because maybe we can all take a little break, but we'll still be here. Like we said yesterday, we're going to be doing a weekly update that will be on Wednesday afternoon. We'll give you that full week update to keep everybody informed in case there is anything that changes dramatically. We want to make sure that we're staying alert and keep everybody updated. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 452, getting closer to June the 11th. Everybody have a good evening.